Hi guys. So today we'll be talking about disorganized thought content. Yesterday we spoke about disorganized disorders or thought form disorders. Thought form disorders. So today we're talking about thought content. So the only thing that we're going to be talking about here is delusions. As we all know that a delusion is a fixed false belief that cannot be. It is based on false inferences, and it cannot be corrected by reasoning. And this thing that it cannot be corrected by reasoning is very, very important, because when someone has got delusions and then you try to convince them otherwise, whatever that they are saying, you're trying to convince them, it's not gonna work. It doesn't work. The only thing that happens is that they get irritated, they get aggressive, and then they just want to start fighting. So the best thing is to find a way to engage with them and be careful and be very respectful. Because if you are not, they get agitated. And that doesn't help the situation. You might have someone who's got delusions, they come in not aggressive, but because you are fighting with them, you are disagreeing with them, and they start now you have an aggressive patient that you have to manage, someone who wasn't aggressive when they came. So it's very, very important to be careful when you manage this kind of patients. So okay, so let's talk now about the types. Fixed false belief that cannot be corrected by reasoning. Yeah, I know there's a very long definition where they talk about this belief that they have should also not be in line with their culture and all those things. It's true, because if someone, to you, they've got a weird belief, as long as it's within their culture, to them it's not a delusion. It might be to you, but to them it's not a delusion. It might be not really a delusion to you, but it might be something very unusual to you, hearing it for the first time, and nah. Okay, now let's talk about the types of delusions. There's let me use a black one. There's a delusion of persecution. So someone who's got a delusion of persecution is someone who just has got this belief that everyone is just after them. Or someone wants to kill them, someone wants to take their job, someone wants to take their positions, things like that. So it's all about, they believe that one way or another they are victims of whatever, basically. So someone is after their money, things like that. Yeah, that's a delusion of persecution. And then we've got a grandiose or a delusion of grandeur. Grandiose delusion. This is someone who has got like, who believes that they are very important, and they normally use known figures. They would come in and say, I'm the president, I'm Ramaphosa, I'm friends with Ramaphosa, I was in a meeting with Ramaphosa. We get a lot of these guys, especially now that there's COVID. Someone who has been talking to Ramaphosa about extending the lockdown. They have had a meeting about the lockdown, and we were getting a lot of this. And then, they might come in and say they are friends with important people, like they play with Ronaldo, Messi, or I taught Ronaldo how to play football. So they always look, most of the time they always look for important figures that we all know. And then they either know them, or they are friends with them, or they are themselves. They are those people themselves. Or they might come in and say that they are very rich, like very rich. They own a lot of whatever, a lot of businesses. They've got money, they've got cars, they've got multiple talents, they've got powers, special powers. That's a delusion of grandeur or grandiose delusion. So guys, there's no way I can be writing all these things down, so please bear with me. And also we have delusion of control. So these people, they sort of like believe that someone else or something is controlling them, that their thoughts and everything, someone else is controlling them. Yeah. And we also have a nihilistic delusion. So a nihilistic delusion is someone, it presents in different ways. Some might believe that they don't exist, they themselves don't exist, or the world does not exist, or the world is coming to an end, or they might believe that they are missing some body organs, they don't have some body organs, or someone else is missing some body organs. That's a nihilistic delusion. Then we also have delusion of poverty. So this is someone who believes that they are like extremely poor, like poor, whereas it's not the case. And also we have a delusion of reference. Delusion of reference is someone, these people, it's like they believe that everything is just about them. They believe that the TV is talking to them, the radio is talking to them or is talking about them, even if it's something like news or weather, or other people are talking about them. Delusion of reference. When it comes to power, if I can go back to grandiose delusion, some believe to be prophets, prayer warriors. They speak to God. Like today I had someone who believed that he speaks to God and stuff. And that one becomes very, because if you are truly a spiritual person, it might be possible. But now what makes us to believe that it's a delusion is because there are other things now that the patient is also saying that makes us to say this patient has got a delusion of grandeur. But talking to God and God teaching you the Bible, if you are a Christian and you believe in God, it's quite possible, whichever way it's happening, but it's quite possible. So it becomes very tricky. But if that's the only feature in their delusion, it will be difficult to say that they've got a delusion if they don't have other things. This is now coming to this thing that I was saying, that if a person, it depends on their level of education, their culture, their beliefs, and all those things. And then we have a somatic delusion. Somatic delusion. There are a lot of other delusions, guys. There's also a bizarre delusion, which we can't cover. Bizarre delusion. So yeah, guys. I don't, I don't know other universities how they examine things like this. Like for instance, where I studied, I don't remember us being asked to define all these things or define one of them or two. I don't remember a test like that. But what I remember is they would give us a scenario of a patient that came in and presented with certain features. Then they would ask you, whichever way they ask it, but they would want you to identify the delusion, the type of a delusion, or even say it is a delusion. Or maybe they would say identify the thought content here, or the the thought content, and then you would say, okay, it's a delusion, and then they will ask you what type of delusion you say, and then they will ask you maybe for 5 marks what makes you to say, which means now you have to quote from whatever passage that they gave you and say, okay, because this person said this and this, you just pick those one word and then you get your marks. So basically they were training us to be able to identify a delusion in a situation. So for those, but it's always safe to know how to identify delusion, to know how to define delusions, especially the common ones. These are very common: grandiose, persecution, reference, and nihilistic, control. Those are very common delusions, especially grandiose and persecution. I think these are the two most common delusions that we meet clinically. So guys, I will leave it here. We'll meet on another video. Thank you so much.